We have Dr. Parvaiz Koul with us today. He is an eminent chest specialist in India. And sir, welcome to the show. You have delivered a lecture on ILD registry in India. So we want to know that what is this ILD registry and how the benefit will go on to the chest specialists who are practicing in India and seeing ILD patients.
See, ILD registry was the first prospective registry of newly diagnosed interstitial lung diseases patients in the country. It was over a period of 3 years that we recruited patients from 29 centers across 90 cities in the country. And based on the recruitment, we found that the results of that registry showed that hypersensitivity pneumonitis was the commonest cause of ILD in the country, followed by other causes, but it was in stark contrast to a subsequent registry which was reported as a single center study from PGI Chandigarh. And the aim of today's debate was to find out the reasons as to what was the reason that there were contrasting results between the ILD registry and the PGI registry. And it was finally decided, actually it came out from the argument and the discussions, that there were certain flaws in both the registries, one being a single center study, the other being a study which was not uniformly representative of all geographies of the country, and there was a bias possibly in terms of selection of the patients, as also a cause and effect of the exposures with the diagnosis that was actually put forth as the commonest cause of hypersensitivity pneumonitis was not brought forth. So yes, the ultimate aim, message from this discussion was that we need to have a countrywide, uniformly defined criteria-based registry so that we can recruit more patients on a uniform and considered criteria, so that we have more data and which is grossly representative of the country in general.
So tell me something about the positive point of this ILD registry that we can take up or our chest physician will able to utilize in their common practices.
So first thing that you need to understand is that for a long time we did not know that ILD actually exists in India, and now that we are aware of the fact that ILD does exist, and we have to find out the local ecology of ILD in a particular area, and chest physicians should strive to get a diagnosis of the ILD, not just at ILD, find out what is the cause of ILD and tailor the treatment of the patients according to the underlying etiology. It's very, very important to understand that there are certain ILDs, and a good majority of them in our study, which are preventable by simple measures, and there are certain ILDs where not much can be done, especially in a country like India where lung transplant programs are not a huge success as yet. But nonetheless, if there are identifiable causes they can be taken care of, and the patients would do certainly much better.
So is there any key message that you want to deliver to our audience regarding ILDs in India?
First of all, ILD is a commonly encountered disorder by all the chest physicians across the country. It has to be suspected. It has to be really looked for. The etiology has got to be looked for, and you try to arrive at the etiology and then treat accordingly.
Thank you, Dr. Parvaiz Koul, for talking to us. Thank you very much, and being a part of PACS India 2018. It is an honor to have you here on our conference. Thank you very much.